Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. We have a great guest on today, Bo Holland. He is the founder and CEO of AllClearID. Bo, welcome to the program.
Thank you, Tom. Glad to be here.
Awesome. Bo, as you know, in our sidebar conversation, what AllClear is doing in terms of identity is a passionate topic of mine. So before we talk about patient identity, tell us a little bit about yourself and why this market, healthcare, and why this type of solution.
Sure. Yeah, so my background is software entrepreneur, so I've been building software companies all my life. Started out as employee 32 at Citrix Systems. We built a nice business there, and then did a stint in the database world, and then moved really into the payments and identity world after that. So the past 20 years, I've been building payment systems for Visa, Bank of America, and then building digital banks in the Nordic countries, and specifically focused on digital identities. And so the identity has just been a passion of mine for a long time. We have a identity protection business where we clean up the messes that happen when data breaches occur and patient identities are affected. So, for example, we were the ones who helped Anthem, Home Depot, and Sony after they had their big breaches. Hundreds of millions of people involved in these. And so we really saw the mess and the pain that comes from weak identity and weak security. And so we had the opportunity to start building really strong, very high convenience identities in the Nordic countries, where they're about 10 years ahead of the rest of the world in terms of how do you really manage identity well? How do you do it securely? How do you do it conveniently, without passwords, without security questions, without one-time passcodes, all the things that we hate. And we really have mastered that technology. And so that has been my professional path. And the answer to your question about why this market, I'm a patient, and it's always been frustrating the way information is managed in this space, and never quite understood it. It wasn't my lane. I'm a banking guy, but I always looked at it and said, someday somebody's going to fix this, right? But it's been an awful long time, and it still hasn't been fixed. And then in 2013, my family, we had a situation. My son he came down from his freshman year at college with a headache, and that headache turned out to be a golf ball size tumor in the center of the brain. So we went on one of these very scary healthcare journeys, and these amazing providers saved his life. They were able to solve it. It was a very rare brain cancer. Brain cancer is rare. His tumor is less than 1% of brain cancers, a mixed germ cell pineal tumor. And so anyway, we went on a very complicated journey from Dell Children's to Texas Children's to MD Anderson, now to MSK, Geisinger, and now he's at Brown University. And the amazing thing to me is I had one foot in the world of identity, and how to do digital identities, how to move money, how to sign contracts, how to do all these things securely and instantly with the digital identity. And on the other hand, I'm having this experience trying to save my son's life, working with these physicians. And the information flow was just appalling. The identity mistakes were scary. The harm that came from people operating, literally in the dark. They were not getting the information that they needed. They had no idea what the other care teams were doing. And so these were the two experiences I was having in 2013, 14, 15, 16, and 17 as we went through this journey. And it was pretty searing. And I thought, well, surely, Michael Dell will buy these poor people a network switch and a computer, and they'll start sharing information like the rest of the world. And obviously he did. And obviously that wasn't the problem. And so anyway, when the pandemic hit and the problem still hadn't been solved, and I realized, well, healthcare is actually going through a shift. They're going to have to go digital now. They're going to have to leave 1982 and their fax machine behind at some point. And a digital identity really is the right kind of tool to solve this problem. And so that really is how I got here and why I'm doing this.
Yeah, it is quite a compelling story. I appreciate you sharing that with the audience. It is quite concerning in the context of, I think, the identity and the whole record matching algorithms is the weakest part of the entire digital system that we've embarked upon starting from the High Tech Act era. And because the EHRs themselves do probabilistic matching. And for folks that don't know, probabilistic matching at its very best and fine-tuned deployment can only be 98% effective in record matching. And to me, it's healthcare. You got to get it right. You can't, 2% is not acceptable. And so needing to switch to a deterministic matching algorithm, that's why I feel patient identity is the key, because your identity is tied to your records and is really the master key in this whole interoperability marketplace that we're moving down, especially with the QHINs in place and interoperability, data sharing being prevalent. And to your point, you've gone from hospital to hospital, and sharing the data has been a challenge in and of itself, right? In my view, you have two problems: data interoperability, as well as how do I know the record that I got is the patient that I have in front of me.
Absolutely. Yeah.
Do you see it the same way?
I do. In interoperability, you have to establish a strong patient identity. And that's where, the digital identities that we've built in the Nordics and banking really solve this problem nicely with very, very high security and very high convenience. They're a bit magic. We really don't have digital identities here in the US, but we've been doing this since 2015 and built a digital banking business where we didn't have identity theft. We did not have scalable fraud. We did not have mismatches at all. And the most important piece was we did this with consumers actually loving these digital IDs. They're so easy because you just identify yourself with your mobile device. It just feels like you're using Face ID, but you can use it across, in any channel, right? So this is an omni-channel solution. You can use it in person, you can use it online, you can use it over the phone. No matter what channel, the engagement is occurring in, you're able to use these digital identities to firmly and strongly establish who this person is, so you can have confidence going forward. And so that really is the magic of these IDs. And again, we don't really have them here in the US, and so people are unfamiliar with it. But this is technology that has been proven. It's been in the market for 10 years. We were doing 1 billion transactions in a year when we sold that business. And now, full time, we are now applying that technology to this particular space. So it will absolutely positively solve the identity problem on the patient end. And then we've solved the integration problem with EHR so that capability is there. Then that leaves the second problem that you mentioned, which is identity. Solving the identity problem is not enough. And so that's been part of the journey and the learning from our experience over the past 12 months of actually having this product in the market. The data side is really the most important piece. That's really what people want, right? Doctors want the data on their patient. They want to see the full picture of the patient. They want to have the context and know what they're dealing with. This is the top frustration of every physician that I've spoken to. The second frustration from every physician is getting paid. So, misidentification is the number one reason that they don't get paid. It's staggering. 33% of the claims get denied because they don't have the accurate context on the patient. They've done a mismatch. They don't have the right insurance information. They don't have the right address, whatever it is.
Well, that is part of the problem. When you talked earlier about Home Depot and some theft of data, we hear this all the time in healthcare, right? Medical identity theft is a very prevalent problem. They, as I always say, they steal the data in the back end from the server side, and they walk into the front door using it, unbeknownst to the healthcare system, right? So the proper identity at check-in is a very real need, as opposed to just showing a fake driver's license, if you will.
Well, we got to do a lot of cleanup in our identity protection business, where a patient would be a victim of a data breach. We then would scan their identity, understand, where it's been misused and abused. And in healthcare, we saw the most intense and sort of severe cases where patients' records were matched together. And whether this was intentional from identity theft or a mismatch, basically your record is now polluted. You've got someone else's blood type in your system. You've got someone else's data in your system, their conditions mixed with yours. And, that can be a real problem for a doctor. You might get misdiagnosed. You might not get a treatment that you need. You might get a treatment that you shouldn't get, right? So again, it goes back to an information problem, but having clarity and making sure that bad guys are not using, your information and creating a record that's false. Unlike in the financial world, identity theft, has a financial consequence. You might lose some money. Your credit might get hurt. Okay, we can repair those things. In the medical space, these mismatches can have far more significant consequences.
Yeah, I would agree. I'll tell you a quick story. I was doing a presentation at a conference, and this gal stood up and said she was an identical twin, but her sister didn't have health insurance. And so she, and part of the patient identity construct that we were talking about had biometric implications, right? The face, the thumb, the thing, or palm scan type of thing. So she would share her. She actually was open and said, "Hey, I share my health insurance card with my sister. This is perfect identity, right? So she's getting health. So the records are just getting destroyed in the context of two people looking like one. But that's the simple side of the equation. That was with intent. There's a lot of scenarios where the identity is stolen, and we need to make sure 100% of the time that the person that's in front of us is the person that we think it is. So tell us a little bit more about AllClearID and how they go about talking to healthcare systems about the importance of identity and how that gets inserted into their ecosystem.
So at core, we're an identity management company, and we really focus on the consumer end or the patient end, in this case. And so there's two things that we're doing is one, providing an identity system that is, it's a federated digital identity system, right? So that's a big word, but essentially you move identity from back-end systems that are not very good at establishing identity. Servers aren't good at recognizing human beings. You move the identity from that situation and you put the power of authenticating an individual and knowing who they are using the mobile device. So you put a high security digital identity on the mobile platform, and now you can use the mobile biometrics and all its capabilities to really establish identity. And so this digital identity is always carried by the patient, and you can do a much better job of knowing who they are from that platform, from that position, than you can from the back end position. And then you can do really interesting things like mobile single sign-on. In the Nordic countries, what we call these digital identities are bank IDs. And so there are 24 million bank IDs that are used across these Scandinavian countries, and it's pretty amazing. An individual can get one bank ID and they can use it at any other bank ID to log in, to sign in, to open an account in 2 seconds without filling out any forms, without using any passwords, without any one-time passcodes. So it's really quite powerful what you can do. And so we made these bank IDs work across the entire economy. It started in banking, where you could use it for all your transactions. It moved to government services, where you can use it for your taxes, for your benefits, for opening a corporation, establishing high identity, and not having to fill out a bunch of forms. Your digital ID has all the information about you. You authorize that information to be transferred to the next bank, to the next government bureau, to whomever it is, and it happens instantly and accurately, right? So it's really, really efficient. And most important, it happens securely. It ultimately moved to the healthcare system. So they adopted it as well. So you can use your bank ID to go get healthcare, go to the hospital, check in, verify who you are, move your information around from one hospital to the other. And then even down to the local pub now, right? You can go to the pub and with your digital ID,
All right,
can
now we're talking.
demonstrate that you are of age and leave nothing behind except a token, right? Leave no personal information. So this is also not only secure technology, it solves the identity problem, but it also solves the privacy issues of leaving information behind. But it's very patient focused. And so that really is the model that we're bringing here. And then the second aspect that we've got to go solve is the data side. And that frankly is where we see, the most interest, right? Patient identity, okay, but where we see the real power is everyone wants the full picture of the patient. And if you anchor yourself with a digital ID in the hands of the patient, you are always with the patient on their entire journey, not part of it, but the entire journey. Like you mentioned, you're in the Northeast, you go to a lot of different hospitals, you move around, you travel. Being able to use that digital identity to have the data attached to the patient and be able to exchange it instantly anywhere in the world, is really quite powerful. The other thing that's really profound here is that by moving to this patient model, where the patient is the director of their information, they are the data broker, right? They're the ones who broker their own data now. They have the right to do it, and we give them the tools and the power to do it. But they operate outside of HIPAA, right? So no one's ever asked me to sign a business associate agreement. No one's ever signed me up as a covered entity. I'm just me. My son is just him, and we have the right to have our information, and now we can move that information anywhere in the world instantly without the complexity of HIPAA, without the complexity of GDPR. So it's really quite profound.
It's not that you, for clarity to the audience, because it's a very large healthcare audience, as you can imagine, you're not signing a BA or a BAA, or you're not defined as a covered entity or anything. It's not being dismissive of the complexity of the platform, but in terms of the requirements, I just don't want the audience to feel like you're being dismissive of HIPAA in the context of the importance of HIPAA as we share data across the board. You're absolutely right. The consumer has no responsibility towards HIPAA, but the security of the data is still necessary as that patient moves from health system to health system or health system to the bank. Thoughts on that?
Yeah, absolutely. So this is not at all to be dismissive of HIPAA or GDPR. Those regulations are really, really important, but their intent is they apply to the organizations that I give my information to, right? And it requires them to be respectful, responsible, keep it secure, keep it private, right? That's what it's about. What they don't apply to is me, right? I can do what I want. And so one of the challenges that we have in healthcare, there's really two things at the root of why doesn't this information sharing happen? Why doesn't my son's data follow him as he goes on his journey when everybody wants it, right? Why is this true? And it really comes down to two things. It's one, competition, and second, the privacy regulations. So these are the two confounding factors. So, providers, our system here in the US, they have to compete with each other, right? So we totally get it, right? I get that. I'm a businessman. I understand, you've got to do that. If you were to ask banks to share their customer data with each other, Chase, please share your information with Bank of America. We'd like you to do that. You can imagine the response they would have. They have to compete with each other. And the same is true for provider organizations. The same is true for payers. So we totally get it. We're asking these organizations to deal with two things at the same time. Go run a competitive business in a market-based economy, and at the same time, share everything you know about your customer so that the patient can be safe. So we're trying to balance these two goals of patient safety and improving the outcomes and delivering real value from a patient perspective. At the same time, we all have to run our businesses. But the regulations really apply to the business side, right? To give them the incentives and the requirements to keep this data safe while it's in their care. They're not intended to limit the patient, right? But the problem that we've had in this space is the patient has not had access to the data. They haven't had a clear right to be able to have the data, and they haven't been able to be the broker of their own data, right? They haven't been the ones who can decide this. So
So true.
what this model does, again, it does not dismiss the regulations at all. They're super important. I do not want people having my data and having no responsibilities to keep it safe, to keep it privacy. That is important. At the same time, I really want my son to be able to get the best care. I really want his doctors to know what's going on with him. I want them to have this context. But HIPAA and competition block that, right? They prevent that. And so this model brings a new way to basically say, hey, the patient can have the data. The patient can be responsible for the data. The patient is not constrained by HIPAA or competition. I just want the best care for my son. And whatever doctor we need to go to, whichever research organization we need to go to, I want them to have the data. And now I have the power to actually make that choice and make that be true. So both things can finally be true, right? That organizations can have the data, they can share it to the extent that it makes sense to them. They can still compete. They still have the requirement to keep that data safe and keep that data private. But now the individual patient also has the right to have the data and move it. And from the patient's perspective, your health data becomes a little bit more like your money, right? So I have money, I put it in a bank account. It's my decision what to do with that money. I can use it responsibly. I can invest it. I can waste it. I can throw it on the ground. I can give it away. There aren't any regulations on what I can do with my money. I can do what's in my best interest. And that's really what's happening now with my health data. I can have it. I can have it in a safe place. We call them health banks. I have the ability to move it wherever I want it to go, where it's in my best interest. And I can do that well, responsibly. I could also do it poorly, right? It's just like my money. But it creates a whole new model where we can start rerouting information instead of business to business, where you have all this friction between competition and HIPAA and GDPR. Now we have a different way to move it. The patient can be the carrier of the data. The patient can make the decision responsibly or irresponsibly, but it's on them, right? They have that freedom to choose what to do with their data. Now, once they give that data and share it with any organization, now those privacy regulations come right back into play, right? So as soon as I give this to my payer, I give it to my provider, I give it to a research organization that's trying to find a cure. Now they've got the responsibilities of those regulations. So to your point, those regulations are vital. It's critical. We are not advocating at all to remove those or undermine them. They're essential.
Wow, compelling. So you have this very complex back end infrastructure to secure the data, but you make it very, very simple on the front end for the consumer to embrace it, and which then allows them to be empowered like no other, right? In healthcare, as you said, average Medicare patient, 5 chronic conditions, sees 9 different doctors. Everybody's got a patient portal, right? You got to assume that 9 different doctors has 9 different patient portals, right? I'm a consumer. I can't deal with all that, right? I want one thing. The audience can't see it, but I'm holding up my cell phone. I want one platform where I can aggregate my data securely and share it to whom I seem fit to share that data with, whether it's another healthcare institution or whether it's my wife or my kids. They all have access to it, but in a very, very secure manner.
That is exactly what we have built and designed. And it really comes from, again, I'm not a healthcare person. And so I come from a different space. And so I look at the world through a banker's eyes, and I look at the payment systems that we have built. For example, the payment system that I built for with Visa. We reimagined commercial credit cards, and now that credit card system is managing commercial payments on cards that used to be run by checks. But in the money space, you again have the ability to put all your money in one bank account where it stays safe and nothing unexpected happens with it, right? Your money stays there. Bank of America does not decide to just move my money on a whim and do something, right? It only
Yeah.
happens with my explicit consent. We call it authorization in the banking world. But I can authorize a payment to anywhere I want, anywhere in the world, and then the bank will make sure that that happens safely. And if I didn't authorize it, right, it doesn't happen. And the digital banks with digital identities are the best at this. And again, we don't have these in the US. We're still using usernames and passwords and knowledge-based questions and all these terrible identity systems. But I can tell you in the Nordics, where these banks have been operating for 15 years now, literally we were doing 1 billion transactions a year, people moving money and making this independent decision on their own. Where do I want my money to go? What do I want to sign? What do I want to authorize? 1 billion times a year. And we did not have identity theft. We did not have any scalable fraud. Right. The only attack that works is I grab you by the neck in person and say, Tom, do this transaction, or else. And we
Yeah.
recommend to our customers that, yeah, do that one,
Yeah.
but it's a very expensive attack for someone to pull off. And so it really is remarkable. And so I look at this and say, why can't I move my health data the same way I move my money?
Yeah, exactly. So, back in when Health IT was kickstarted with the High Tech Act, there was always the comparison of healthcare to the financial institution, right? And there was a lot of frustration because of that comparison. But you have to ask yourself, from a financial institution, my money is always in my bank, right? And if someone steals it, it's recovered. Right.
Mhm.
And I can go to my, the money machine and I can take money out of Chase Bank and it'll transfer into Merrill Lynch or whomever. Right. So, and it's secure and, you always know where your money is. Right. And there's the same thing needs to apply to healthcare in that record matching is important, right? This idea that 98% of the time it's okay, and or let's said differently, 2% error rate in the exchange of your medical information is okay. That's nonsense, right? So this is healthcare. It's got to be right 100% of the time. And part of healthcare is I'm paying my copay with my credit card. I have a health insurance card and I have claims processing. They're all interrelated relative to a healthy and sound delivery of care infrastructure. And patient identity, to me, is at the center point of all that for that to be successful and equivalent to the performance of the financial model. Would you agree? Disagree?
Oh, I 100% agree. And, this is a problem. Imagine if we had a 2%, mismatch rate in the banking world, where 2% of the time, money went to the wrong place, the wrong person authorized it, that would be a staggering catastrophe. Nobody would die, money would be lost, right? In
Right.
healthcare, we got the same problem. We do have this 2% mismatch rate, and, people can actually, experience real harm from that. And so why is that? And so this is another one I looked at long and hard. And again, being a credit card and payments guy, the reason that we don't have this problem in banking is that we issue a secure credential to the patient, to the consumer. We give you a credit card, we give you a debit card, we give you an HSA card, right? And that becomes a secure credential with a chip on it that does a nice job of making sure that only the card can move the money and the card is bound to the right account. So there's never a mismatch. Have you ever had the experience where you used your credit card and the money went to the wrong account? The charge happened and went to the wrong bank, went to the wrong account. It doesn't happen. right? But it's because you've issued this secure credential. And so they have their problem, though, these credit cards. They don't have an identity component to them. A Visa card is really good at saying, okay, there's money in this bank account. We know which account it needs to move to, and we can move that money instantly in a flash and do so securely. What your credit card doesn't know about is who presented the card. Was it really Tom, or was it a bad guy that stole your card, right? That is the problem. And that's exactly the problem that digital identities solve. Digital identities are the next generation credit card. They do everything a credit card does and better, but they also manage the identity aspect at the same time in the same transaction. So now when you do a digital identity payment transaction, you do not have any mismatches and the money moves safely and securely, but you also have bound to it strong identity, multi-factor identity using the biometrics on the phone, the physical device, the cryptographic protocol underneath it. That eliminates all the attacks like man-in-the-middle attacks, malware injection, right? All these things that plague the U.S. payment system. We have defeated those in the Nordic payment system with these digital IDs. So that magic combination of convenient identity that's highly secure, bound to a transaction, now you get them both. And so why can't we apply that very same model to healthcare was the question I was asking myself.
Yeah.
And in the end, at first we thought, well, we just need to bring this technology to the providers and to the EHRs, and they can integrate it and solve the problem. We have recently learned that really isn't enough. We have to actually create a new entity that represents the patient. So one of the ahas along this journey was, who represents the patient? Is it my payer? Is it my provider? Is it the HIEs, the QHINs? Who represents me? And so when I need my data moved, when I need a doctor informed, when I need to get a prior authorization done, who solves the problem of, getting my data, moved where it needs to go? And the answer is nobody, right? And so the patient really is the little guy in this space, and there's not an institution that stands behind him. In banking, it's the bank, right? In money banking, right? Your bank stands behind you. Something bad happens with your money, a transaction goes bad, some fraud happens. They step in and represent you and then go make it right. And they lobby on your behalf. They make sure that you're powerful. And so we don't have that. And so part of what we realize we have to do, in addition to providing the core technologies, we actually have to stand up institutions. So we're calling them health banks, right? These are health data banks that the patient owns, the patient controls it, and it represents their rights. And now patients, in fact, do have powerful rights, right? We are all, as of October 6th of 2022, you and I, Tom, we have non-negotiable rights to our data in electronic form at no cost. That's amazing, right? It took an act of Congress to make that happen, but it did happen. And so now the health bank can step in and provide me the technology that I need as a consumer to exercise that right. And most importantly, to be able to use that right responsibly and safely.
Interesting. We're going to have to stop it there. To the audience, if you want to learn more about Bo Holland, you can certainly find him on LinkedIn, but you can go to allclearid.com. Bo, thanks for joining the program. Very much appreciate it. Great conversation.
Thank you, Tom. Really enjoyed it.
That's today's shift. I appreciate the audience taking the time to tune in. If you missed part of today's episode, you can tune back in at the healthcarenowradio.com at the same time, 11 a.m. or 7 p.m. Eastern throughout the week. And be sure to check out the program page at thevirtualshift.co. As well, remember to follow me on LinkedIn, Twitter at FoleyTom, and follow the show's hashtag, TheVirtualShift. I'm Tom Foley. Until the next shift.